Hi, I'm going to explain to you in this video what knee osteoarthritis is, what its causes are, and I'm going to offer you some exercises for its care and treatment. Knee osteoarthritis is one of the most frequent. It's one of the stars within osteoarthritis in the body due to its frequency. Because it causes many problems, it tends to be quite painful. And also because it's increasingly occurring in fairly young people. Let's start by explaining what knee osteoarthritis is. And I want to start by explaining what the word osteoarthritis means. So, if we break it down, we read that it has a first part, which is arth, which is from arthritis of the joint, and a second part, which is osis, which whenever you find it, will mean destruction, degeneration, aging. Therefore, knee osteoarthritis is the degeneration, aging, or destruction of the knee joint. Well, the first thing I want to show you is in this anatomical model, so that you see what a knee looks like. It will be important, because then the treatment will be mainly focused on relaxing all these structures, loosening all this up, and mobilizing all these structures. So, we have here the anterior part of the knee. This is the external part of the knee, outside. And this is the internal part, the inside of the knee like this, and the back part. We are going to remove the patella with the quadriceps patella tendon. We are going to remove the fascia lata that would be in the area of the external knee here. We remove the fascia lata. We are going to remove the muscles of the goose leg. You can see here, we remove the entire goose leg. We are going to remove the quadriceps muscle. External, internal, external, internal, and the crural, which is the one underneath. We are going to remove the biceps femoris, which attaches down there on the fibula. Now you can see quite clearly. This is the major adductor. You can see quite clearly how the joint is formed. Do you see this bluish color? That is the articular surface, the cartilage. That's where the frictions occur. And if we look down there, do you see these structures here? Those are the menisci. Do you see inside there that looks like a crescent moon? Those are the menisci, and there will be another layer of cartilage down there. This is the joint. You see the movement is flexion extension, and it also makes some slight rotations. In osteoarthritis, all these cartilage structures, the capsule, the envelope, and the synovial, if affected, wear out. Let's look at this in a more schematic way. We have the femur bone and the femoral condyle. We have the tibia bone at the bottom. And we have this cartilage part that belongs to and is attached to this bone. And this cartilage part that belongs to and is attached to this bone. And here in the middle, this white strip is where the friction between both cartilages occurs. There is no space. It's virtual. This is where the friction between the cartilage of the top bone and the cartilage of the bottom bone occurs. It is designed to slide and support these frictions very well. But with all those factors that I will tell you later, it can wear out. It can wear out so much that it loses thickness to the point that it can start rubbing, as I said, bone on bone. Okay. And that results in inflammation and pain. Let's see this same thing in a photo in a very schematic drawing as well. You see a healthy joint here. Brand new complete cartilage. Great. And you see here how the cartilage is already damaged, with areas where the thickness has been lost. These bone proliferations start to appear. These are typical formations of knee osteoarthritis. Now that we know what knee osteoarthritis is, I'll try to explain how we get here, how the body gets here. And obviously, the first thing we have to talk about is age. Okay, it's the factor that everyone understands. Not because obviously we see people with osteoarthritis who are older. I do think it's an important factor. But I insist, there are more and more young people who also have it. So it cannot be a unique factor. And if it were a unique factor, all elderly people would have knee osteoarthritis, or even the same person would have osteoarthritis in both knees. And sometimes one knee is much better than the other, which is more worn. That's where factors like mechanical alterations come in. This is a very important factor, one to be taken into account. These mechanical alterations will cause greater suffering of the structures. We're talking about a car with a twisted wheel. We're talking about a car in which that wheel is suffering greater mechanical wear because it doesn't work in its place. It doesn't work as it should. In the knee joint, we may be loading more weight on the internal compartment, on the internal condyle. The knee may be twisting and working mechanically poorly. This is going to greatly favor the development of knee osteoarthritis. This is going to be many times influenced by visceral, vertebral, lumbar dysfunctions. Vertebral dysfunctions, alterations in the lumbar area, the pelvis that are going to destabilize and unbalance the legs and knees are many times determined by visceral dysfunctions that are going to cause the vertebrae to become unbalanced. It's a concept that I think we've already developed in several videos on this same platform. For example, inflammation in the cecum, in the right iliac fossa, is going to generate an iliac opening of the right iliac of the pelvis, a whole alteration in external rotation of that limb. That foot may be stepping more on the heel, etc., etc., etc. All of these are visceral causes that are going to mechanically unbalance. So, we could say that osteoarthritis is mechanical with a visceral origin that will also affect and alter the lumbar mechanics, which in turn has an influence downward. Stress and sustained muscle tension. This is a concept that I'm going to develop a bit more deeply because it seems very, very interesting to me. And I'm going to explain it with an example. If you take your arm right now and squeeze and release and squeeze hard and release and squeeze hard and release with your fingers, you can do this for days and days and days. You'll be able to squeeze and release thousands of times each day and withstand this for thousands of days. The tissues are prepared, perfectly prepared, to withstand this. However, if you squeeze more gently, but maintain and maintain and maintain it for a few days, you're going to have the area become gangrenous. You're going to get a pressure ulcer, and it's going to become gangrenous. Tissues cannot withstand continuous pressures. No living system can withstand continuous pressures and things. We need day and night. During the day, we activate, we go up. At night, we relax. The heart needs systole and diastole. Muscles need to contract and relax. Cartilage needs compression and decompression. Being squeezed, being compressed, being decompressed. There are sustained tensions on the joints. Muscle tensions. Tensions that make the cartilage constantly tight day and night. Even in bed, there's going to be a slight, subtle, but constant pressure. That's what's going to destroy cartilage the most. That's what's truly destructive. You can work very hard during the day, but if you rest well at night, you'll withstand it for a long, long time. However, you can be doing a very light job, but doing it for 23 hours a day. And in a very short time, you'll break down, because what will cost you is not having that rest phase. That happens in the joints. That happens in the body. And it leads to joint wear and tear. Well, besides that, I always put repetitive work and sports activities as not a fundamental cause. Although everyone wants to blame their work or sports activity. It's not that I did anything, it's just the way I am, and the way I do things. That's why it's worn out. Well, that doesn't help. In other words, if my car's wheel is misaligned and I drive it at 140 km per hour every day for 200 km, it will wear out faster. But it's not a fundamental cause. It's not the main cause. Because if I'm mechanically sound, if everything works well, I can drive 200 km every day, and the car will last much longer without wearing out. And finally, genetic or congenital causes. Well, there are occasions when cartilage may be thinner in some people. Well, we have to mention it because many people are interested in genetic causes. Personally, I think that if we always blame something that cannot be solved, when we have mechanical, visceral, tension, and stress-related issues that we can act on, it is not good. I mention it, but personally, it is not something that I give much weight to, except, well, if there are congenital things that can alter mechanics. If things from birth, well, they may be. And as for treatment, I won't go into it here because I think the video would be too long. So, I encourage you to look for it within the OnSalus Health portal, where you will find a video entirely dedicated to exercises, stretches, and ways in which you can work on your knee joint to improve symptoms. You're not going to solve arthritis, and it's something that cannot be solved. But you can achieve that this arthritis gives you a little less trouble, and that you can have a better quality of life by working with the exercises, stretches, and self-massage techniques that we recommend on the OnSalus Health portal. You know that you can find all of this here on your OnSalus Health portal.